Today is day 12 of 30, sharing information that you should know if you've been diagnosed with fatty liver or cirrhosis. In the past 10-ish years, one of the biggest changes in what's recommended for patients with cirrhosis has to do with protein intake. When I first became a dietitian, the recommended guideline for protein intake for patients with cirrhosis was to have between 0.6 to 0.8 grams of protein per kilogram of body weight. That's just slightly lower than what's recommended for kind of the average healthy person. However, in more updated guidelines, the recommended protein intake is between 1.2 to 1.5 grams of protein per kilogram of body weight. That's just slightly higher than what's recommended for the average healthy person. So why the change? The medical community used to think that dietary protein intake would contribute to a condition called hepatic encephalopathy, which is a debilitating side effect of cirrhosis that essentially makes patients extremely confused. And in a mild case is just confusion. In a more severe case, a patient could be intubated in the ICU on a breathing machine. So in theory, it used to be thought that the byproducts of protein digestion would cause toxic substances to be built up and accumulate in the brain and cause this confusion or hepatic encephalopathy. However, once more research was done on this, it was found that patients that were eating a high protein diet versus patients that were eating a low protein diet didn't have any difference in hospitalization rates for hepatic encephalopathy, regardless of how much protein they were eating. And on top of that, patients that were hospitalized with severe hepatic encephalopathy, when they were fed as they were recovering, if they were fed a high protein diet, they recovered at the same rates as patients that were fed a low protein diet. The primary difference between these cirrhotic patients that were eating low versus high protein diets was that the patients eating a low protein diet were far more likely to have more significant muscle loss and more significant frailty. So because of this, the recommended amount of protein for patients with cirrhosis is now 1.2 to 1.5 grams of protein per kilogram of body weight daily. Patients will still have hepatic encephalopathy at the same rates, regardless of protein intake, but hopefully patients will be able to better maintain muscle mass and reduce the chances of becoming frail and too sick for transplant.